Jess here from Our Yoga, and I am with Kayla, who is the owner of the Bozeman Birth Center and an out-of-hospital midwife. I'm going to ask her a couple questions that I've been getting from moms, and just I know a lot of you are wondering right now, so I thought it would be really helpful to hear it from the source. So Kayla, do you want to say hi, introduce yourself at all?
Sure. My name is Kayla Wright. I'm a certified nurse midwife and a women's health nurse practitioner. I've been at the Bozeman Birth Center for since 2014. And now I've been the owner for about the past year and a half, and so I'm the medical director there. I've been in Bozeman that entire time for the past 6 years, so I'm feeling a little bit more like a Bozemanite these days. And I'm just thankful to Jess for having me to talk to you guys and hopefully shed some light on what's a really anxiety-inducing and confusing time for everybody.
Yeah, what's it like to be a birth center midwife right now?
Yeah, so things really haven't hit the fan in Montana the way they have in the rest of the country. And hopefully it stays that way, but maybe we're just at the beginning. So everybody's sort of hoping for the best, preparing for the worst right now. And so being a birth center midwife generally before all of this was a very special, intimate experience. You sort of become part of people's families throughout this process. There's lots of hugs, and my prenatal room has a bed with pillows and armchairs, and it's all very cozy. And now there's not so much of that. My prenatal room is vinyl, and so that I can sterilize it after every patient. And I'm not giving people hugs, and I'm wearing masks when I'm coming in within 6 feet of people. And we're doing lots of things kind of like this via telemedicine. And so we've had to alter things quite a bit that look not what the usual warm and fuzzy birth center stuff looks like, while trying to still maintain the integrity of what a birth center experience is like, of being individual and personalized and intimate. So it's an interesting line to walk.
So are you recommending most moms do telehealth visits and then just come in for checkups, or how does that look right now?
Depends on where you are in your pregnancy. So there are certain visits that are important to do in person. So the first initial intake visit, when we're doing all the initial lab work, we're going through health history, we're hearing a heartbeat for the first time. That's an important one in person. The gestational diabetes test is an important one. And then the last month is important to be seeing people, actually physically seeing people and doing vitals and doing growth measurements and checking on baby, because the last month is where most pregnancy complications arise. And so that's why you physically need to see people in the office. You can't necessarily do everything like this.
Are partners allowed to come to those appointments?
Yes, as long as they are well. And we encourage people that if you just want to show your friend the birth center, or your mom is in town and you want her to come and see the birth center, leave those people at home.
That makes sense. What about for ultrasounds? Because I know typically that's something that if people want to do those, or if they're needed, they go to the hospital. What's that look like right now?
Yeah, so we generally actually use Sound Diagnostics, which is not affiliated with the hospital, but they are a full diagnostic ultrasound facility. Everything above 20 weeks is read by a maternal fetal medicine specialist out of Missoula. They're in network with all insurance companies, and their cash price pay is a fraction of what the hospital is. They medically are excellent for ultrasounds. That's where we were sending people before. And now it's even more of a validation to do that, because people don't have to go into a hospital. That is still a place that is for healthy people. They're not sick people going in there.
Lovely. And that's important, I imagine. So how much has business increased? Or like, are you getting a huge influx? Like, I mean, I know we chatted a little bit, but what's that like?
Yeah, so we've been certainly getting a lot of phone calls of people sort of in a panic state of wanting to get out of the hospital and knowing what that looks like. And then we kind of have to bring people down to earth, because making decisions out of panic and out of fear rarely leads to your desirable, good, healthy outcomes. We've gotten a lot of calls, and we've done some intakes and some transfers over people who are appropriate risk candidates to be out of hospital and in a birth center setting. I think the caution is not everybody is a good candidate to be out of hospital. We do low risk, healthy, normal singleton pregnancies. And so high risk pregnancies still need to be in a hospital. It's a scary place to be, but it is still the safest place to be if you are not a good candidate to be out of hospital. And so we're doing a lot of talks. We do lots of, the initial consult is a telemedicine visit just like that, so that I can get a feel for them, they can get a feel for me, and to make sure that this is the kind of setting that they want to be in. And then after that, and we move forward, if they decide to come in, that's when we actually start doing more in-person visits. But it's been a very interesting thing to navigate. And my office manager, Brooke, is who most people talk to at the beginning. And so she's been able to walk people through some of those things to give them an idea if this is the birth center is a good place and a good fit for them. So we've just been having a lot of conversations with people, and people are starting to transfer. And this is all 2 weeks old is when sort of all of this started to really hit in Montana. And so, the amount of things that have changed in the past 2 weeks is staggering. And I wish I could say that I think we're at the peak and it's going to get better from here. But I'm not sure that that's true.
Definitely. So what does it look like to transfer care to the birth center?
So it depends on where you are in your pregnancy. If you're really early in your pregnancy, we have a lot more time to get to know each other, because it will be much more similar to somebody who just started at the birth center early. If you're in your last month of pregnancy, that looks a little bit different. Our visits are going to be longer. We're going to talk about more things. Really encouraging people if you're transferring in the last month, you should have a doula. That is absolutely the best thing that you can do for your birth experience. And really, if you're transferring in at any point, even outside of that first month, a doula is a really great resource. If you were planning on a hospital birth and are now planning on an out of hospital birth. And part of that is I can do a lot of teaching and explanation about what this is going to be like, but a doula is actually going to walk with you through that. And there are also birth professionals that I think I've birthed with most of the doulas in town. They know how we work. And so they can give you another little perspective on what to expect in an out of hospital setting. But as far as the actual transfer in goes, it's pretty seamless. We get medical records from the hospital. We've been doing this for years, even outside of COVID-19, of people who want to transfer in at some point in their care. We get medical records. We use Billings Clinic Lab. And so all of the lab results still transfer over. And we just pick up care right where they left off at the hospital.
What about, is it an option for people to start care with you and then if things die down, potentially transfer to the hospital, like say that they're newly pregnant?
Yeah, totally. The prenatal care looks a little bit different in our setting just because it's usually it's a little more cozy, and my prenatal room is nicer, but we do get to spend a lot more time together and talk about things. But medically, I'm looking at all the same stuff that the hospital is looking at. So if somebody wants to start their prenatal care at the birth center, but they want to give birth in the hospital for any reason, they're welcome to do that at some point down the line. Transfer into the birth center and transfer out of the birth center are pretty easy processes, since the hospital and I have the same standards for safety and care. And so I'm a certified nurse midwife, and so I have the same scope of practice and the same level of education that the midwives in the hospital have. And so we follow the same protocols and such. So the transfer in, even if you want to transfer into the hospital midwives, is pretty easy.
That must be a huge relief for a lot of women to know.
Yeah.
So. And then can you talk through some of the options for pain relief that people might have if they're totally new to out of hospital birth?
Yeah.
You could speak to it, but I'll let you speak to it for sure because you know a lot. So.
Sure. Well, so do you, Jess. So, I mean, a big thing is to start with is our culture tells women they can't give birth. That it is horrible, that it is scary, that you won't be able to do it. And so that is what most people go into birth thinking. That's what the media tells us that birth is like. And so there is this fear narrative around birth to begin with. So that's the first piece that increases pain. I actually did my entire senior thesis research paper in midwifery school about how people's expectations of what they will experience in birth then inform their expectations of birth, and how it's sort of a self-fulfilling prophecy that if you're terrified of birth and you think it's going to be scary and horrible and painful, that's what you're going to experience. And the reverse is true. Birth is hard no matter what. I'm not trying to say that birth isn't hard, but there is this idea that women can't do it alone. And I will tell you, I mean, I do this for a living. Women absolutely can do it without medical intervention. So that's the first piece. Second piece is the birth is a very instinctual right brain experience. When you watch women labor all around the world, they all look the same. They're doing the same movements. They're making the same noises. They're choosing the same positions. This is not something that you learn how to do. It is built into your DNA, how to birth. And so when you leave people alone and you let them do what is already internally what they do it really well. If you let them really get into this zone, they do fine. But if you're constantly pulling them out and asking them to use their left brain, asking them to make decisions we lost baby on the monitor, I need you to be in this position. Straighten your arm, your IV is kinked. Machines pinging, people coming in all of the time. It's really hard to stay in your groove. And that's when people start to spiral and lose it. And so that's something that looks a little different in the birth center setting, we sort of leave people alone to labor the way their DNA tells them to labor. As far as pain relief options, our big one is the tub. Those, Jess, you've seen those tubs. They're like these giant 2-person, they're magic. And they're not called nature's epidural for nothing. They're not going to take away the pain entirely. They're not going to make it a fully painless, easy birth, but they take the edge off. And so when you're sort of approaching that moment and you're like, okay, I need something else to get through this, that's what the tub is for. And there's also, you can labor in whatever position you want to. Well, those rooms are big, and we have birth balls, we have birth stools, we have the bed, we have the tub, we have the shower, we have lots of position changes open to people. So you're never stuck in just one position.
Okay. I guess one thing that we chatted about before too, but I'll address too, is I know some people are probably really worried about their providers getting sick.
Right.
You want to speak to that at all?
Yeah, so that's a big thing that we are cognizant of, is that keeping the birth center a place that's for healthy people, and keeping the providers safe. And so it's a little sad for me to have to wear a mask around people, but that's something that we are doing. And my nurses back each other up, and then I have a backup for my office manager. And the home birth midwives and I in the community have all banded together to back each other up, because if we get sick, we'll be down for a couple of weeks, but then hopefully we come back immune and we can really help and support the rest of our community. So we're all individual practitioners, but we all understand that this is unprecedented and we haven't seen or worked through anything like this before. And so we all need to band together and make sure that our patients and our community is as well taken care of as possible.
That just gave me chills. Yeah. Seeing everyone help out and work together. I think you answered most of what I can think of. Do you have any other last things of advice, or is there like a resource that would be helpful if people are considering this? I mean, obviously watching this video would be helpful, but is there anything else you'd like to point them to before they just call your office and ask questions, or just any last little helpful pieces of advice that you have?
Yeah, I think, and I find myself doing this too, is getting into the anxiety spiral, and everything you're reading and everywhere you look, this is the only thing that people are talking about. And for good reason. This is really serious. We are taking this really seriously. But it is not, we're going to survive this. The human race has gone through far worse than this and come out the other side. And that is true in this case also. We're very, very focused on physical health right now and keeping people physically healthy. And mental health has sort of taken a back seat. And we've had this idea of telling people in quarantine that you This is the time to be creative and learn a language and learn to play an instrument. And people are just paralyzed in their anxiety and feeling then really guilty that they're not learning to be better people. And I think we have to give ourselves a lot of emotional grace right now, that this is big and this is scary, but that we are going to get through this. So I think that it is important to keep some perspective and keep some hope and keep some light while taking this really seriously.
That's beautiful. That's a really good reminder too, that, you know, just do what you need for your mental health, and it doesn't have to be starting something new or, you know, focusing on all aspects of us. So
Yeah.
well, thank you so much. I so appreciate what you do and for sharing some knowledge. This way I will have something to direct all the moms who ask me to. And yeah, if people want to get in touch, what's the best way?
So if you go onto our website, which is bozemanbirthcenter.com, there's a contact us link. You can send us a message through there. Our phone number is on there also. If you want to email with questions, it's hello@bozemanbirthcenter.com. And so just to start with basics of what this looks like. I think that it is important, when my one last point is, people who are transferring in to give birth at the birth center, they need to want to give birth in a birth center and not just because they're afraid of the hospital. And I think that's an important distinction. Again, making decisions out of fear is a dangerous way to go about your life.
Wow, that's super powerful. Well, thank you so much, Kayla. I really appreciate it. And I know all the moms.
Thank you, Jess.
Too. And stay safe, and we'll be thinking of you.
You too. I'm sure we'll be seeing a lot of each other.